I've always wanted to be a scientist from a very young age. I knew I wanted to interact with people, but also wanted to do research. So I was a really combination of being able to do both. I was always very interested in the brain, especially when something goes wrong. I think the brain is an incredible organ, and I really was hoping to combine both clinical and research and came across the field of neuropsychology. I have over 10 years of experience with epilepsy, both clinically and from a research standpoint. So typically most of the patients I do see are being evaluated for epilepsy surgery. And part of that is really, the way that I say is like, we're one piece of this larger puzzle. They're getting MRIs, other kind of scans to really figure out if they're candidates for surgery. But we also want to know how they're doing from a cognitive and kind of psychosocial standpoint. We do typically 2 to 3 hours of cognitive testing. Is a pretty lengthy appointment. It's very unusual, like unlike your other typical appointments. We really want to capture how people are doing from a cognitive and thinking standpoint. And then what we do is we compare them to other people of their same background with the question of, are they performing where we expect them to perform? And if not, what are the reasons? And then if there's a neurological condition like epilepsy, we're able to figure out, is it medications? Is it the type of seizures? To really get a full picture, we provide recommendations to the patient and their family and the treatment team in terms of how can we improve these aspects of cognition, but also in terms of providing the support and social support that the patient may need. The most rewarding part is really taking the time with the patient. I think it's our specialty is unique that we spend several hours with one patient and their family. My clinical interviews tend to be hour long or even more, and really get to know the patient and their family, what's happening. Oftentimes a diagnosis with epilepsy could really be life-changing, right? So really checking in and taking the time and using my clinical skills to kind of talk about how is the patient doing, how the family is doing in terms of their quality of life, and really how can the clinic could help them and support them as they go through, let's say, the surgical workup.